Bereaved people often talk about having a broken heart, but experts say there's an increased threat of heart attack after the death of a loved one. Now, a world-first study led by the University of Sydney has found that common medication can reduce that risk. Here's Professor Geoffrey Tofler, who was the lead investigator of the research. Geoffrey's with us in the studio. Thanks very much for coming in.
Right.
So how much does the risk of a heart attack increase after a bereavement?
There are different studies that show different proportions. In a study I was involved in Boston at Harvard University, we found that there was an 8-fold increase in relative risk in the first week after bereavement, and from 1 week to 1 month there was still a 4-fold increase in risk.
So is this for people who have pre-existing conditions or not?
It's a good question. It was for people who may have had pre-existing conditions or not. So it was for both men and women of different ages.
So tell us about the study then. What exactly were you investigating?
Well, when I returned to Sydney, together with a colleague, Tom Buckley, doing his PhD, we looked to find out the reasons why people might have an increase in risk. And that's been shown in other studies up to 6 months following bereavement. And so we found that there was an increase in heart rate, blood pressure, clotting factors, as well as the increases in anxiety and depression symptoms that we would expect. And so, building on that, we then said, well, can we do something to actually reduce those risk factors? And that's the results of this study.
So how can you reduce the risk factors?
Well, in 85 bereaved people, we found that low-dose beta blocker and aspirin given daily for 6 weeks was associated with a reduction in these risk markers. So a reduction in heart rate, blood pressure, clotting, and surprisingly and pleasingly, there was a reduction in symptoms of anxiety and depression, and we had no adverse effects on the bereavement process.
Is it just people who have been bereaved who are affected like this, or could it be any big life event such as divorce or job loss, or even the death of a pet, which really hits some people very hard?
Well, certainly a lot of the physiologic changes that occur in bereavement could also be seen in these powerful conditions. I think further studies are needed to be done in that area. Ours was sort of focused particularly on bereavement due to the loss of a loved one.
It's interesting you mentioned there that the medication that you were suggesting didn't interfere with the whole grieving process, because that's important, isn't it?
Absolutely. Our goal is to protect people to reduce their heart attack risk while recognising that bereavement is a natural process and that people need to go through it.
What's the next stage of your research then?
Well, we are certainly interested to discuss it, to see what implications there will be for GPs, for the family members. I think it's important for family members to be aware of this and also to not ignore symptoms that their grieving relatives may have. If they do have symptoms, to certainly speak to their doctors, and I'd actually recommend that bereaved people do go to see their family doctor to see how they are, and from a GP point of view to understand which people might be at particular likelihood to get benefit. We will be doing further studies to look at the stresses associated with hospitalisation for family members if someone's in hospital, and also trying to look specifically at very acute emotional stresses as well and see what we can do from that point of view.
Professor Geoffrey Tofler, thank you.
Thank you.